Hello, everybody, and welcome back to the Bryan Laskin Podcast. I'm your host, Dr. Bryan Laskin, and with me today, an incredible guest, Mr. Dave Pryor. Thank you for being here, sir.
Hey, Bryan. Thanks for having me.
Well, it's been a while since we've done a podcast,
Yes.
and I'm excited to talk with you because I have a new perspective that I would love to get your expert opinion on.
Okay.
Okay, we started off podcasting together many moons ago.
Yeah.
Then since you've transitioned, we've transitioned, there's been a lot going on. And I think when we started podcasting until now, there's been some seismic shifts in our industry. Would you agree with that?
Sure.
Okay. And I think that right now we are at a crucial point in time. It's a time for clinicians to get way more involved in our industry. I think we've drifted from that. We have a lot of, now keep in mind, I'm a big fan of DSOs. I mean, from the perspective of I've worked with many of them. I think that, there's positive pros and cons of group practice, but one of the big pros is it brings a level of accountability and quality control to our industry that, frankly, single practices. I remember when I first was training dentists, I'd go to laboratories and I'd just be horrified with what I saw.
Sure.
Right.
Yep.
So I'm not, this is by no means an anti-group practice message.
Right.
This is a people that know how to run a dental practice should be helping run dental practice message. Okay. For those of you who haven't met Dave before, he's been obviously a regular on the podcast.
Okay.
Because I've just assuming everybody knows who you are.
Yeah.
But that's a bad assumption. So maybe could you introduce yourself to the audience?
Sure. Well, I'm Dave Pryor. I currently work with Think Forward. We're an MSP that provides IT services specifically for dental. But I came up in the industry working with Bryan here, and we built up Opera DDS together. Sold that off to Vine Dental. Then I went and worked for Planet DDS for a few years, and now I'm with Think Forward. So
Cool.
It's going great.
Well,
And then we've podcasted together well over 100 times.
yes, we did.
Yep.
Yes. Not my best 100, but 100 times.
No, they weren't your best 100. You're right.
Well, so Dave, I'm going to go back to what I was talking about, because you're right. It did sound like, how did you frame it?
I like you, but
I like you, but
it's the breaking up story is what it sounds like.
let me be more specific, because here's what I'm seeing happening.
Yeah.
There's a lot of group practices that are having trouble right now.
Mm-hmm.
And there's some that are just kicking butt. And I think the difference between those that are doing well, and this goes back to not just group practices, any dental practice, and those that aren't doing well, it really gets down to one thing, and one thing exclusively. How well are you focused on the experience of the human beings in the practice, right? Because what that doesn't show up on is a spreadsheet. And it's very easy to look at a spreadsheet and look at a cell and go, hey, what would happen if we would reduce this number by 10% and then see a number go up on the other side of the spreadsheet and go, wow, that's going to be great. Let's do that. And what you don't realize is you're totally decimating the experience for the employees and for the team and for the patients in that practice. And I don't think, frankly, that you can know what the hell you're doing when it comes to doing this if you haven't worked in a dental practice, right? And there's so much of our industry, from our people who are telling people in dental practices what to do, to software vendors that are just like spraying BS that just doesn't make sense, and nobody's paying attention and noticing. So my message to clinicians is it's time for us to take back care. We need to get back in the dental practices and say, okay, we have a voice. Because you know what? The difference between the DSOs that are kicking butt and the ones that aren't is, do they have a clinician at the highest level providing leadership? Does that make sense?
Yes. And for those of you that have seen many podcasts between Bryan and myself, this will come as a shock to you, but I agree with Bryan.
Oh my gosh.
So
wow.
I really think that a missing ingredient in dental is often the voice of the clinician. And exactly what you were saying when you're talking about somebody that has no idea of what a workflow in a efficiently working practice looks like, and having them tell you how to do it better, and they have no clue. And I'm like, and so for me, it's frustrating even for me as a non-clinician because I've had the distinct advantage of having your tutelage along my career in dental. So I at least have some vision into the what I always term as the hamster wheel that clinicians are on all day, every day. When I'm working in my role in sales, I'm always very conscious of what is going to be beneficial for the clinician and for the patient. And I find it, to your point, more and more we're looking at how can we save 10%? How can we do something that has no input from the clinical side? So, yes, I agree with you.
Well, thanks. And, here's kind of how I came to this revelation. So first of all, my own dental practice, right, went from, net new patients, meaning the people going in the front door, minus the people going out the back door, of 155 patients a month, right? So we were 155 in the positive every single month, which is why we had to keep expanding, buying other, locations, stuff like that. To negative 60 a month, right?
Jeez.
Okay, that's a big swing, right? But also, then I go online and I see these software vendors talking who what percentage of software vendors who are creating our systems for dentistry actually have a dentist leading what the hell's going on.
I come in with no agenda. You surprise me with whatever we're going to talk about. But I was actually going to come in and talk about that today. In that AI, one of the things you and I talk about all the time, is like Dave's all in on AI, and Bryan has some reservations on specific aspects of AI within the industry, right? But what I think, one of the things that I think that AI is going to enable is doctors to actually get more involved in the different aspects of modernizing their practice because they can work with AI. Whereas before they just didn't have the time. Now they can ask AI to do things. And one thing in particular, when you got into the software industry, to your point, there was no other dentist doing what you're doing, coming out with software. There were one, two, there were very, very few, but there were next to none. And now with AI, I think it gives more opportunity for a clinician with a good idea to be able to move things forward.
Okay, so let's talk about AI because it's a great example of where clinicians need to take back care. Now, what you're talking about is actually coding with AI, which I agree with you, right? There's that, but I'm not at all skeptical of AI. I mean, that's not true. I think we need to have the way it's being leveraged today in dentistry. I don't particularly like. Here's why. Because AI is best doing things that humans can't do, right? So what's it known for in dentistry right now? Colorizing an x-ray.
Yep.
Okay, great. But guess what? We don't have a diagnosis problem in dentistry, right? We have a confidence issue. And if clinicians don't have the trust of their patients, having it colorize it so you can say, oh, guess what? You don't trust me, but you'll trust software more than me. Yes, there's benefit there.
Yep.
Is it the highest value for artificial intelligence? Absolutely not. How about this one? Ooh, AI receptionist. Great. Well, you know what patients want to do? They want to talk to an AI receptionist. No, they don't. They want to talk to a human being.
Right.
So where can we leverage AI to actually benefit everybody? It's doing things that humans can't do, right? That's what we're doing at Tooth Apps. So what we're doing is saying you know what? Let's say I go to make a reservation at a restaurant and I confirm that restaurant's appointment.
Yep.
Do I get 24 messages saying, are you still coming? In some restaurants, yes.
Yeah.
And you know what I do? I don't go to those anymore.
Yeah.
So how about we use AI to actually say, how does this human being want to be communicated with? What's the message? What's the cadence? In what format? And we customize our messaging to patients based on that human being. Sally at the front desk can't do that. AI can. That's how we communicate. And then you know what? If we do this right, then the patient opens up their phone, they create an appointment that AI, by the way, has served up the exact right appointment for that patient to be most profitable for your practice, to have the highest probability of that patient showing up, right? That's great uses that humans can't do. And then you know what happens? Sally can be freed up to pick up the phone when a new patient calls and it doesn't go to an AI receptionist, right?
Yep.
Why do I think of that workflow? Because I've run dental practices before.
Right.
And I know the human beings who call your practice, they would prefer talking to a human. Now, if you want to use AI receptionists, great, but let's leverage artificial intelligence for what it should be best for. Replacing humans where humans suck at the job, or they're not the right fit, or they can't even do it. And then let's leverage humans to do what they exactly should be doing, which is interacting and building trust with other human beings, which is exactly where most offices are implementing AI today. That's the problem that I have with AI in dentistry right now.
So let me expand further on your appointment reminders situation. Back in the Opera DDS days, you had a receptionist that did the outreach
Correct.
to get patients to show up. And this particular receptionist was amazing at her job. She was so good that you were going to build an app within Opera DDS that did this, that did her essentially what she did, and call it whatever her name was. And so, like I've told you in the past, Bryan Laskin works 3 years into the future. In this particular case, it was about 8 years into the future. But it sounds like you're moving in a direction that
We're doing it.
Yeah.
Not in the, I do remember her name, but didn't end well. So I won't use it.
Okay.
So let's just say Sally.
Okay.
So Sally was great at that job.
Yep.
But the reality is we were relying on a human being, not a system.
Yeah.
Right.
Yep.
Which is never great.
Yeah.
So what I was trying to do was build a system so that we didn't rely on that human being. Because like I said, didn't end well, which many times it doesn't. Right.
Yeah.
Or she left. But that one in particular, there was beef with another employee. And reality is that she had a particular skill set for that job, which a lot of people don't have.
Right.
Because picking up the phone and getting no 12 times to get the one yes, not too many people get really excited about that one yes.
Yep.
So they want to go through 50 no's. She had that skill.
Yeah.
You know who else doesn't care? AI. It just does the job. Right. And by the way, using the phone probably isn't the best way to get people back in. So how do we know? Does this patient want this particular message should be going via in-app notification through the patient app? This one should be an email. This one should be a text. This one, by the way, have a human call. This one use AI to call. AI can determine all of that easily.
Yeah.
Humans can't.
Yep.
Right? You know what a human can do? When a new patient calls, they can have a friendly voice to say, "Oh my gosh, yes, thank you for calling. I'd love to have you come in. How can I help you?" You know what I mean?
Yep.
And I don't know what percentage of people would want to talk to a human being when they're calling an office for as a new patient. But my suspicion is it more than 50%? Yes. Right now, that doesn't mean that there's not value in having AI receptionists. What it means is let's leverage AI for what it's good for, and that's not first, right? And as an industry, we are not doing that. We're colorizing an X-ray. Whoop-de freaking do. I'm sorry. It's just not that impressive. I know if you have 100 dental practices and your clinicians are really bad at doing case presentations, then having it colorize your X-rays so that patients actually say yes to treatment in place of humans actually doing what they're good at. Okay, there's value there. Yes, I see that. But the reality is let's also use it for what humans aren't good at. And very few companies are actually looking at that. That's what we're trying to do at Tooth Apps.
Now, I will jump in and defend the colorizing of the X-rays.
Okay.
Because, it's a sales tool. Let's break it down. It's a sales tool, and it does a really good job of helping people. You are particularly skilled at building confidence in yourself with your patients. And so you never had the problem of saying, "Hey, we need to do this. You've got an issue," and you'd get pushback from the patient. You didn't have that issue, but there are plenty
I
of people
totally agree.
in the dental space that do. That particular tool really, really helps. So I am pro imaging.
I am too.
Colorization. I think it's great.
I am too. Okay, look, we live in a world where over 50% of the diagnosed dollars never gets to collected revenue. Right.
Yeah.
And that's what Tooth Apps is trying to solve, big picture, right? And care with our patient application. But what I'm saying, and I totally agree with you, there's value there as a sales tool.
Yep.
Do dentists need it to diagnose?
No.
Absolutely not. It's a sales tool.
I
now,
agree.
Is it the most valuable sales tool that you can have in your practice? For some, maybe.
Yep.
For some, maybe, because they are not good at connecting with patients. They don't provide clarity to the patients, and patients don't have confidence in their care. So getting a colorized X-ray actually oversees like that's like helping. It's like training wheels on a bike, right? It helps you if you don't know how to ride the bike.
Right.
How about we solve the foundational issues through systemized connection with patients, keeping them connected, providing them clarity and confidence so that we can really drive revenue, recall, and referrals versus colorizing an X-ray first, second, I don't know. My whole point is that there's value there. However, it's been overblown because it is a sales tool. It's not, and here's what's actually going on though in like the large groups, because I just did a lecture. I did 2 lectures at the Minneapolis meeting. And I asked who's using AI in room of both times. There's about 100 people in the room. Mm-hmm. 1 or 2 hands went up. Okay. Why? These were independent dentists, individual practices. Mm-hmm. If there was DSO, a bunch of hands would go up.
For sure.
Why? Because the people who are leading the DSO think it's a diagnosis tool. They think dentists and hygienists need this to actually diagnose the treatment. That's why it's going out there. And the reality is that's not the case. The human beings in the dental practice are working their butts off. They're good at diagnosing care. The problem is driving it to collected dollars. And you're right, from a sales tool, it'll help. But once the patient leaves the practice, they have no more connection. They have no more clarity what's going on other than the X-ray was colorized. So it is helpful. However, it's not the most helpful use of AI at all. Not even close.
I'll agree with you there. But I'll say that in the DSO space, the reason that it is such a heavily leveraged tool is that it's a reportable metric that you can send up to leadership, and leadership goes, okay, the AI tool has told us you've got this amount of outstanding untreated care that needs to be taken care of. Let's help you get that.
Okay.
Right?
Okay. When you say unscheduled treatment, that's different, right? That's different because 50% of treatment doesn't come to collected dollars. And now they're doing that. But the reality is, how do you actually take that unscheduled treatment and turn it into collected dollars? It's not just identifying it. Identifying is step 1, but there's 12 more steps that AI can do better jobs that, like, frankly, we're doing at Tooth Apps that the other companies aren't even thinking about because they don't know how to do it because they're not run by dentists. Right?
Yeah.
And you're right. It's reportable. What does that mean? It can go into the spreadsheet.
Yes.
Right?
Yep.
It can go into the spreadsheet. My point, we're circling it back to the beginning, is that we need people who can read spreadsheets. We also know we need to have people that can look at the spreadsheet and go, this doesn't have that cell on it. Right? There's no cell. How well are we making patients feel cared for?
100%.
Doesn't exist. Does not exist. I just heard another podcast. I'll say this, even though it might be a little off color. That said spreadsheets are like bikinis. They hide the best bits, right? So, right. Not everybody's gonna like that, but
getting ready for HR to jump in here.
I just think it's funny, and it's true from the perspective of if you know how to run a dental practice, you're looking at a spreadsheet and you're going, it ain't on there, like, right? Yeah. Or like that's why there's people will say we need to cut X from the practice, and like we can't do that. Like it'll have massive negative impacts. And by the way, they're right. Yeah. Much of the time.
Yeah. No, I agree 100%. When you think about hygienists, for example, patients love their hygienists, right? And that is not on a spreadsheet. And one of the things that is easy on a spreadsheet, that's the most expensive hygienist. We must get rid of that person. And it's like, you will lose half our patients.
Well, and right? What's the number one reason why patients don't like hygienists?
Because they hurt them.
They hurt them.
Yep.
Is that on any spreadsheet? No. I mean, you could survey and get it on a spreadsheet, but you don't. Right? But you have to know that the number one reason is because they hurt them. I've never talked to a leader in any group practice that is like, I want to make sure my patients aren't getting hurt by hygienists. Right? In fact, most general dentists are. And here's another sort of hot take on this. In the last 20 years, 25 years since I've been out of dental school, the technologies that has really changed the game are 100% clinical. If you think about it, you look at how we're fabricating restorations today versus when I got out of dental school, it's bonkers. The clinical stuff that's coming out. I mean, we have robotics, there's robot hygienists coming out now. There's robotic dentists like prepping teeth, right? It's just crazy cool stuff. But when it comes to like having a patient schedule an appointment, what a pile of garbage. We're relying on a phone a lot of the time, most of the time. This is totally moronic. Why? Because dentists they just want to focus on they want to implement the technology stuff that they're using, and they ignore the other half, right? The systems that we're working within. And they rely on human beings like Sally to do a great job. But the reality is we need to change that. And we as clinicians need to take back care from the perspective of how do we actually care for people in the practice. And a lot of that doesn't have to do with your clinical dentistry. It has to do with how you make an appointment, how you pay your bill, how you communicate after the fact, right? And clinicians need to pay way more attention to that, because you know who is? The people that read spreadsheets.
Yes, for sure.
Right?
Yep.
That's where I think that like we as clinicians need to get involved. Not everybody wants to, by the way, and I get it. Like if you just want to focus on doing amazing clinical care, fantastic, do that. However, the groups that are growing, the practices that are growing, have a dentist at the helm who knows how to run the business in addition to the clinical outcomes.
I think in large part, you're right.
In large part, I'm right.
Yeah.
I'll just take that as 100%. That's about as good as I can get from you on any podcast you ever did.
DSOs I can point to, they're doing a pretty good job, and they're run by dentists. But
not run by a dentist, but they probably have a very astute clinician on the leadership team, I would guess.
Yeah.
Right? I'm not saying that it doesn't be run by. They have to have a dentist who knows how to like run a practice and do very good dentistry at a high level that they listen to.
Yeah.
I definitely don't think you need to be a dentist to run a group. And the flip side of that is if you're an independent dentist, figure it out. You know, you can't ignore it because you're going to be run over.
You know, you've talked about this for years. Somebody that's been working in dental for 40 years and really don't have anything at the end. Their retirement plan is selling off the practice.
Mm-hmm.
I mean, that's just mismanagement on the front. Like, there's a lot you can do throughout your career to really create better revenue cycles.
If you're putting technology into your practice, I'd think of 2 questions to ask after you get the lay of the land, what they're doing and whatever. Number one, it'd be the very first thing I would ask for if I'm going to look at it. Any technology I'm implementing in my practice is how does it make our patients feel? Number one.
Sure.
Right?
Yep.
If it makes our patients feel worse, don't do it.
Right. Yeah.
Right?
Yeah.
I mean, it sounds simplistic, but nobody does. Right? Nobody really thinks about it from that perspective. Because if you make people feel more cared for, you will make more. So first question to ask is, how does this make our patients feel? And I would say, who the hell in this business knows how to run a dental practice?
Mm-hmm.
If the answer is nobody, maybe don't do it. And there's a hell of a lot of that in dentistry, right? Like, who at X software company actually has run successful dental practices? And so they build within the systems, the actual systems that support the hard people working in the practice versus adding more to them, right?
Yep.
That's a big miss in the industry, and those 2 things. Now, obviously, there's how does it affect the quality of our care? How does it affect, the ROI, all of that? But you're not going to get a positive ROI. I don't care what the spreadsheet looks like if it messes with your systems because the people don't know how to run a dental practice, or it makes people feel worse, right?
Yeah.
And that goes back to like wrapping back the conversation. Great conversation, Dave, as always.
Sure. Yeah.
So thank you for being on the Bryan Laskin Podcast.
It's always fun.
And I look forward to hearing more from you in the future and seeing all of you back here on the next podcast.